Irritable bowel syndrome, IBS, medicine, Alumen. The purpose of knowledge shared here is only educational and to increase awareness. Please always consult your doctor before taking any medicine. Self-treatment may always be injurious. Friends, today we shall know when to use medicine Alumen in irritable bowel syndrome, IBS. Dose is suggested at the end. दवा की मात्रा और पोटेंसी अंत में बताई गई है। आइए जानें इरिटेबल बाउल सिंड्रोम में दवा एल्यूमेन कब उपयोगी है। Sinking sensation at epigastrium, worse after eating, nervous exhaustion with inactive bowels and tremulousness of lower extremities, pulsation at pit of stomach, sensation of constriction as of a cord, sudden violent pains with nausea, deathly faintness and prostration, cold sweat। आइए जानें मेडिसिन एल्यूमेन के कुछ अन्य महत्वपूर्ण लक्षण। Paralytic weakness of the muscles in all parts of the body, a sort of lack of tone. Extremities are weak. This weakness is felt especially in the rectum and bladder. The stool becomes impacted from want of ability of the rectum and colon to expel their contents. Bladder is slowed down in its action. With great difficulty urine is avoided. After urinating, the bladder often remains half full. Urine is very slow to start, and when the patient stands to urinate, the urine falls down perpendicularly as in Hipper. Tendency to induration wherever there is an inflamed surface. Ulcers with indurated base. Many of these indurations will have cancer as an ultimate. Phthisis, brightsdisease, diabetes, cancer, etc. Tendency to induration of the neck of the uterus and the mammary glands. Glands become slowly inflamed and do not stop with ordinary congestion and hardness, but become as hard as bullets. Tendency to colds which settle in the throat, indurating the tonsils. Young children growing up with enormously enlarged and very hard tonsils, in whom every cold settles in the throat. Pain on the top of the head with burning. The pain is a sensation as if a weight were pressing down into the skull. Pressing hard upon it from an ice-cold cloth relieves. She wants the cloth changed and made cold every few minutes. It is a queer thing that a pressing pain is made better from pressing upon the part. This is like cactus, pressing pain on vertex relieved from pressure. There are some strange, rare and peculiar symptoms for which paucity of remedies, and we have to work in other channels and along side tracks in getting the constitutional state of the patient. Vertigo, lying on his back with weakness in pit of stomach, better opening eyes, better turning on right side. Palpitation is brought on from lying on the right side. Slowness and sluggishness of the muscles throughout the body, a slowing down of all the muscles a sense of weakness in the arms and legs, constipation, some urging to stool without result, or he may go several days without desire. There is no ability to expel the stool. He will strain a long time with no success, and finally after many days the stool is passed and is an agglomeration of hard balls. Large masses of little hard balls like marbles all fastened together. Stool less frequent, drier and harder. Large black hard or in small pieces like sheep's dung. No relief afterwards. After stool there is a sensation as if the rectum were yet full with the weakness or paresis of the rectum, that is, the rectum is not strong enough to expel all its contents, and hence the sensation of unfinished stool. In the rectum there is ulceration with bleeding from the ulcers. The hemorrhoids ulcerate and they are very painful, so that after every stool he has prolonged suffering, a dull aching pain in the rectum. Hemorrhage from the bowels during typhoid. Alumen is useful when there are large clots passed. Catarrhal conditions prevail throughout the remedy. In old scrofulous psoriatic patients who are subject to chronic yellow bland discharges from the eyes with enlarged veins, chronic yellow discharge from the vagina and from the urethra in the male, chronic painless gonorrhea. In addition to the catarrhal discharges, there is a tendency to ulceration, so that there are little ulcerative patches in the vagina, little phthous patches in the vagina and on the cervix of the uterus. When a patient is suffering from a chronic gonorrhea, instead of the discharge becoming white, as in a gleat, it remains yellow, and there are little indurations along the urethra, discharge with little bunches along the urethra. These are little ulcers, and beneath the ulcers are indurations. In a little while the patient will have 2 or 3 strictures unless he gets this remedy, because these little ulcers will each end in stricture narrowing the canal. Another strange feature is the catarrhal states, and in the ulcers it is its tendency to affect the vessels. The veins become varicose and bleed, so that there may be bleeding from any of the inflamed or catarrhal areas and bleeding from the ulcers. Neuralgic pains about the head. These head pains come on in the morning on waking. Purulent ophthalmia, chronic sore eyes, sees things double by candlelight, nasal polypus left side, lupus or cancer on the nose, face pale as a corpse, lips blue, scirrhous of the tongue. Mouth, minute growths like indurations and infiltrations, bleeding from the teeth decay and the gums recede from the teeth become loose, scorbutic appearance of the gums, mouth burning, ulcerated, grey, dirty, spongy, skin about a tooth, which is surrounded with proud flesh, offensive saliva. In the mouth we have the same general feature of ulceration with dryness of the mouth, dry tongue and throat, and great thirst for ice-cold water. Uvula inflamed and enlarged, predisposed to tonsillitis. Flatulence, patient suffer from cramps and colicky pains, boring, rending, tearing pains, retraction of the abdomen and drawing in of the navel, weight of uterus presses down colon, granulations of vagina, leukorrhea, copious emaciation, yellow complexion, indurations of uterus, even scirrhous, ulcers of uterus. Question is so painful that it becomes impossible, voice entirely lost, chronic loss of voice from a low state of the economy and from always taking fresh colds, expectoration of much yellow mucus, scraping of the throat all the time to get rid of a little accumulation of yellow mucus, dry cough in the evening after lying down, chronic morning cough, old people with morning expectoration, catarrh of the chest, suffer from copious ropey, hemoptysis, and great weakness of the chest, so that it is difficult to expel the mucus. In this it is similar to antimonium tartaricum. Alumen has a weak spine with coldness of the spine, a feeling as if cold water were poured down the back. Pain in the dorsal spine on a line with the inferior angle of the scapulae, weakness in this region and in the shoulders, sensation of constriction as of a cord or band around the limbs, feeling as if a cord were drawn tightly around the upper arm, the clumsiness of the fingers as seen in dropping things, as the pain in the lower limbs at night, the lassitude and numbness, sensation as of a cord around the leg under the knee, soles sensitive to pressure on walking, feet numb and cold although warmly covered, legs cold to knees, bruised pain in all the limbs, crawling, tingling, paralysis of all the limbs, kept awake at night by a sensation as if the blood rushed through the body. Many complaints come on during sleep, nightmare. He is sensitive to weather changes and very sensitive to cold. Thank you.